I'd like to introduce to you Dr. Dan Christopher, who's the Health Secretary, Ministry of Health, Lilongwe, Malawi, an internal medicine specialist with passion to improve healthcare in Malawi. He is Secretary for Health in Ministry of Health, providing strategic policy direction of health services in the country. He has worked in several high-level positions, both in the government and the private sector and academia as well. He is keen to improve the diagnostic, local expertise and human capital for the healthcare service in Malawi. At this conference, he is looking forward to enhance his collaboration with India. Please join us. Welcome Dr. Dan as he shares a few words with us. You want to?
Oh, yeah. Okay, right. Thank you very much. I got to recognize Mrs. Anita Niranjan, MD, CIM India, and then the speaker, Dr. Constantinides. It's a very humbling event for me and for the Malawi delegation. Coming from government, this was facilitated by our colleagues, but also the Indian High Commissioner to Malawi. And we really appreciate his passion to make sure that Malawians are able to access care. Within our delegation, we have our Director of Quality Management. And our Quality Management Directorate has been functional for a year now. And I've been in this position as Secretary for Health for that same period of time, so a year in this position. When I came into the ministry and meeting my Quality Directorate, I asked him one thing. Now that you have a Quality Directorate, are you planning to recruit members of staff that are outside the mainstream health workforce? And in fact, specifically, I asked, do you want to recruit someone from the tourism industry? And the reason I asked him this question, I hope Dr. Andrew Likaka remembers that, because I was saying that quality can be in healthcare, can be mimicked to ourselves. In fact, I was wondering how or why we chose this event to be in the hotel. I think we chose it because we think that hotels give you individual care. And that's what we want to do in tourism. Tourism is about not taking care of our members of staff or patients as a statistics, as a group, but individualizing that care, that they enjoy it. And so the Quality Directorate, I'm still challenging them, that I would like to see someone from a graduate of the tourism industry being part of the Quality Directorate. Because as we increase access to care of our people, we would like them also to feel that their care was individualized. Let me give you a background about Malawi. Right, so Dr. Constantines looked at the role of government in medical tourism, and I thought I start on that platform. What is the role of government and why are we here? Malawi is a democratic republic. And just like India was a previous British colony, and for any investor, peace in a country is paramount. And Malawi, you are guaranteed this peace and has been peaceful for the past 50 years. All our elections have been peaceful. We are having another election next year, a tripartite election, and be guaranteed it will be peaceful. Malawi is divided in districts, 28 districts of the country. And that's what forms the divisions of healthcare delivery. And good for people that are here is that you can directly go into any of these 28 districts because care at that level is decentralized. My role as Minister of Health will be to facilitate, but you can also get to the decentralized system. And in fact, when we came here yesterday, we realized that India also has the same platform where provinces have their own, they can get their own policies, you can sign MOUs with them and move on. So Malawi is the same. And recently, only last week, I'm pleased to mention here that our central hospitals have just been given mandate by cabinet, which was sitting 2 days ago, I think 2 days ago, that our central hospitals can also become autonomous. So you have the option of linking directly with our central hospitals. The population of Malawi, 18 million. So you may say, but that is too small if you compare to a province in India. No. That's where you can have impact. So don't look at that population as small, but look at it as a potential for you to show and shine and have an impact. It's a young population where 64% of our population is below the age of 30. In fact, not 15, but 30 years old. It's predominantly a rural population, but if you look at the figures, there's high potential that there'll be urbanization. How is healthcare delivery streamlined in Malawi? So there are basically 3 providers of healthcare in Malawi. The public sector, which is government, and then we have profit organizations, private sector, and then we have not-for-profit organizations. And in this particular regard, we're talking of faith-based organizations. So in Malawi, we have a whole group of faith-based organizations that are providing care to 40% of our population in hard-to-reach areas. Just take note that the model of faith-based organizations is such that the Malawi government provides salaries to all their staff, almost all their staff. And the Malawi government establishes a service level agreement with the faith-based organizations. And that is the model, it's one of the models that we can also partner with any tourist here, because there's existing framework that Malawi government can tap on to link up with you if you are interested to come to Malawi. Of course, as a country like all countries, we have 3 levels of care: primary, secondary, and tertiary levels. These are our health indicators, generally showing an improvement. Under 5 mortality was 112 in 2010, now at 63. The HIV seroprevalence was 10.6 in 2010, and to date is 2016. In fact, let me stop there, because the HIV seroprevalence, HIV epidemic, has been with us for about 20, 30 years now. But what you see in health in HIV is a model where about 30 years ago, this was an epidemic which was about to wipe the globe, especially in our countries. But 15 years down the line, you can see a trend in changing the spectrum of this disease, and tells you how global collaborative effort can make a difference to healthcare. That's basically the essence we're talking about here around health tourism. In Malawi, about 20 years ago, the life expectancy went as low as 35, which is the lowest in history of the country, and it was largely because of HIV. To date, the life expectancy is 61. And in fact, we are questioning and saying, should government still maintain its retirement age at 60 now that we're able to control HIV? So those are policy decisions that we may need to look at. So when you're investing in Malawi, now don't look at a population which would be going on to be a young population, but will grow into people that are older and requiring care in conditions like non-communicable diseases, cancers, and the like. Those are some of the common conditions in Malawi. But let me touch on the last two. We're seeing emerging problems with road traffic accidents in Malawi. I think a few of our countries are also experiencing the same. And then non-communicable diseases. Hypertension, you'll be surprised, is at 33% in the recent STEP survey that we did in Malawi. Cardiovascular disease, 8.9%, diabetes and cancer are emerging. And I'm bringing this because in medical tourism, people look at chronic conditions than acute ailments. So here is a potential where cardiovascular disease will be emerging as a major issue in Malawi. So yes, we would like to be a source of medical tourism, but we can as well be a destination for medical tourism. The government has a health sector strategic plan, which was launched last year. And in that compact, the theme is universal health coverage, which means that every citizen of Malawi should be able to access care. That's what government is challenging itself. But of course, people say that universal health coverage is a country-specific item. Depending on your development level, then you can define what universal health coverage means to you. But to the ordinary Malawian, universal health coverage means that for each of their ailments, they should be able to be taken care of. Training institutions, those are some of the training institutions. We're able to train medical doctors in Malawi to specialist level. We're able to train nurses, and we are able to train allied workers. Our biggest gap in training, and I was sharing this with our colleagues, is biomedical engineering. So if there is an investor, a collaboration that Malawi benefit most is training of healthcare personnel, but our weakest link is biomedical engineers and managing equipment. So that area is certainly paramount. But biomedical engineers will not shine if they don't have the requisite specialists that will utilize their innovations. I think all of us will be interested to know what is the financing in country. What are the financial opportunities? Malawi government puts health probably third, after firstly agriculture, second is education, third line of budget that takes the lion's share of the budget is health. And it ranges between 9 to 14% of the total government expenditure goes to health. So it's really a priority to government. In terms of the programmatic areas, HIV, malaria, and TB, those are largely funded by our development partners. And this particular one, a Global Fund, PEPFAR, World Bank, the United Nations family, and then we got bilateral donors, Germany, UK, Norway, China, Egypt, and India. All these countries are supporting the healthcare financially. We have a multilateral body, which is the Health Sector Joint Fund, which basically is a composition of UK, Norway, and Germany. This provides a mechanism to finance healthcare. So, for example, if you're providing medical equipment, we would use, if you're a provider of medical equipment, we would use this platform really to put a tender to you, for you to apply and see whether we can purchase from your organization. Within our delegation from Malawi, I'm pleased to mention that we have Mr. Chikoti, Sidney Chikoti, who is Chief Executive of the biggest medical insurance in country, the Medical Aid Society of Malawi. And within that Medical Aid Society of Malawi, there is direct link to care within Malawi, but also outside Malawi. So Medical Aid Society of Malawi is able to facilitate care both within and outside the country. How has Malawi and India cooperated in the health sector? Malawi has been referring patients that need specialized care to India. And the three main disease illnesses that we are sending patients to India are cancer oncology, which is forming about 70% of those numbers, We're sending patients that have heart conditions, especially children that have got congenital heart diseases, but also patients that have previous cardiovascular disease like myocardial infarction, but those not acute because we can't transport them within the first golden hour, for example. So those that have been stabilized home but requiring, for example, coronary artery bypass surgery and other interventions, those we've been able to send to India. But you will realize that in that particular case, then we are a source. What we are requesting here is to be a destination because the market is there. One challenge that I face in my office is, how do you choose these patients to go to India? And I don't know if it was you in your shoes, how you would answer that question. Because we've said, as a country, we would like to provide universal health coverage. And if I can only choose 200 people out of 18 million, what is the criteria? Therefore, I'm encouraging you to put Malawi as a destination for medical tourism. The Malawi government, through the Ministry of Health, is now moving towards establishing centers of excellence. And so already we are establishing a cancer center in Lilongwe, and that's a potential for you to partner with us. That cancer center should be opening in October to December, between October to December this year. So we can talk around this area in our break time. We are also establishing an orthopedic center within the same facility of Lilongwe. But we would like to go broader than just those two centers. So centers of excellence are within our interest. Other areas that you may want to partner with Malawi are areas of energy. In our country, we have huge challenge with provision of energy sources in our facilities, where we're using the ESCOM grid, which is basically hydroelectric power generation. But with the erratic rains and siltation in our water streams, we've been having challenges in providing electricity to our facilities. So we are now going towards alternative energy sources. So we are encouraging people to invest in alternative sources of energy. Solar, for example, is something that could be explored. So we can discuss this item. It's of paramount importance to us, solar energy, but also the provision of medical equipment. Let me stop at this, but to thank the organizers, Anita, and the team here, for giving opportunity for Malawi to showcase what it is able to do, but also attract you to come to Malawi and invest in Malawi. Thank you.
Thank you so much for that, Dr. Dan.